about a very simple method to try to avoid injection-related complication during filler injection. So we know that hyaluronic acid injection are among the most commonly requested procedures in aesthetic medicine, with a well-known risk of vascular complication. The simple one is the bruising caused by small vein puncture, but some rare cases of embolism and vascular occlusion have been described. For example, in the PRS in 2014, an article reporting blindness following a hyaluronic acid injection in the ophthalmic artery was described. And so we should always to keep in mind the important vascular network of the face, especially for the periorbital zone, before to inject hyaluronic acid. And other adverse events very important, such as skin necrosis of the nose, has been reported too. So to date, we have no method to prevent injection related complication validated. And transillumination is a procedure that involves creating a virtual light underneath the skin. And depending on their diameter, subcutaneous vessels can be detected, and with a strong contrast just at 5 to 6 millimeters. So we have hypothesized that transillumination could help to detect vessels and to avoid the risk of vascular complication during hyaluronic acid injection. So we decided to perform a prospective randomized single-blind study that was approved by our ethical committee on 72 healthy patients who had sought for facial injection of hyaluronic acid. And transillumination was used for vessel mapping just on one side of the face to avoid bias prior to perform the injection. And no technique was used on the other side of the face. For the randomization, patients were asked to choose a sealed envelope indicating on which side of the face this method will be performed. So we wanted to assess the sensitivity of this method and to assess the vascular risk and the vascular complication on both sides of the face for all the patients. So this is a very simple method. I just want to show you. So it is better to turn the light off, and with this device we can see the vessels, especially the vein, superficial vein of the face. In this case, on the left, we have the temporal superficial temporal vein and the periorbital veins. So with the skin marking at the same time, we can draw the vein decurs. This is very important when we want to perform a correction of dark circles, because it's the zone that always give up some complications such as bruising on the following weeks, following days. So at the end we have something like this, and so we can inject between the drawings to try to avoid the vein. So the result of our study shows that only some arteries could be detected during this procedure, especially the superficial temporal artery, but not the other arteries. But all the veins were detected, especially the superficial temporal vein with in the infraorbital, supraorbital, and supratrochlear vein. And concerning the complication rate, no major complication was observed, except for minor complication as bruising. And this complications rate was higher on the half of the face where transillumination was not used. So, in conclusion, we can say that our preliminary finding shows that this method allows to identify the superficial vein of the face and to reduce the vascular complication rate. But we don't have to forget that since arteries are more difficult to detect, it is mandatory to follow at the same time the other preventive recommendations, such as apply ice before injection, use blunt cannulas or small caliber needles, aspirate before injecting, and always inject slowly and in small quantity. So we recommend use of this device since it is simple, non-invasive, affordable method with a very, very small learning curve. Thank you for your attention.